Thank you guys for letting me be here this afternoon. My name is Angelia DeSalle. I'm from Jefferson Parish, and I was a healthcare worker, and I am also vaccine injured by my Pfizer vaccine. Earlier, I think you guys were given this big packet of information, and I kind of just wanted to go over. I've been sitting here listening to everyone's testimony today, and I can relate to everything that has pretty much been said here because I have been living this for almost 4 years. I took my vaccine the day it rolled out for healthcare workers at West Jeff Hospital. I had an older physician that I worked with. I managed an outpatient surgery center, come to me and ask me if I would go get vaccinated to kind of just show my leadership for my employees. I never had a problem with vaccines before. As a matter of fact, I ordered my flu vaccines every year for my employees. So therefore, I was definitely not anti-vax. And just to be honest, I didn't do any research on this vaccine because I had trusted all of the other ones in the past. So why wouldn't I trust this one? So I just wanted to kind of go over a couple of things in this packet with you guys. On the very first page, this is my consent form from West Jeff the day that I went and took my vaccine. The highlighted areas that you see there, first of all, the hospital did not use the consent forms that was given to them from the CDC. They made up their own. And the first highlighted area says that I have been giving signs and symptoms from the inactive influenza vaccine. Okay, so first of all, this consent form is wrong. I took my vaccine on January the 5th. Whenever I got out of the hospital and I went and met with them on January the 14th, all of the vaccines that they had given, they had no idea that these consent forms were even wrong. I pointed this out to them. The next thing that is highlighted is that you could have soreness, redness at injection site, fever, muscle aches, headaches, and tiredness. Okay, well, this is where my story begins. 4 days after my vaccine, I lost the use of my legs. They did not work from the waist down. I was not told that. I started having seizures. I started having convulsions. I could not feed myself. When I lost the use of my legs, I went to Ochsner Urgent Care over there on the West Bank, and I was transported on over to Ochsner, the West Bank campus, and I was treated awful there. As a healthcare worker, I had given 20 years of my life on the business side of healthcare, but I'd given 20 years, and I was absolutely treated awful. Those nurses would literally hear my bed shaking from me seizing all over. They would run and hold me down, and the only thing that I got in the hospital was Benadryl, melatonin, and that was it. They gave me nothing. I was begging for treatments. I did get 3 MRIs, and if you go through and look, I have included those hospital records for you guys. But on the next couple of pages is what I received after I got my vaccination from the hospital. There was no what ifs. I had no idea that I was going to be having neurological issues. I had no idea that I was going to be having seizures. So the only thing that I got was pushing the V-Safe. Sign up on V-Safe, log your stuff. And I did that as I was supposed to. I was directly going to the CDC through V-Safe and logging everything that was happening to me. And then on the next page here, they sure wanted me to promote that I had taken my vaccine. Please hold this card up, post it on social media. So I got nothing else whatsoever about the signs and symptoms of what was going to happen to me. On January the 5th, when I entered the hospital, that was the most devastating time of my life. We were still under the patients couldn't come in and sit with you at the hospital after a certain time. So as I was being transported by ambulance, they wouldn't let my husband come with me. I thought I was dying because I was completely healthy. So I had to face all of this on my own. Although, I've heard stories about the patients in the hospital, their families were not there to be with them during COVID. Well, I was one of those patients being vaccine injured. And I laid there in that bed and I watched this vaccination drive-through, and no one was helping me. And the only thing I could think looking out my window was, my gosh, how many more people are going to be like this? After about the third day of not getting any help, my son decided to release a video of me on social media, asking for if anybody else out there could help me, please get in contact. That video had 7.4 million views in a couple of days. And things got really wild for me after that. I was kicked out of the hospital, basically. I was told that my insurance would no longer cover my stay because the only thing Ochsner Hospital, and this is all in this packet that you guys have, the only thing they diagnosed me with was bilateral leg weakness. And it is all throughout these records that I was having seizures and I was having convulsions. I was completely hidden. I was one of the first healthcare workers to have issues in our state, and they did everything that they could do to hide me. So I'm trying to make this quick, guys. I'm sorry. It's been a long, almost 4 years. I went home and I started pursuing physicians. Me and my husband have spent our life savings on treatments, and that's why I'm here today. I am walking. I am doing better. I still have issues. I still have days that I can't walk. I still have days that I can't feed myself. But no doctor got me there. I got myself there on my own and researching on my own. We need to be studied. We need some financial help for people like me. And there's thousands of us. I helped create all of these organizations. Someone had mentioned FLCCC. Dr. Pierre Corey, I was probably one of his first vaccine-injured patients because he saw me in LA. I've been all over the place. I've been to Washington, D.C. speaking on this. I've been everywhere. He saw me in Los Angeles have one of these awful seizures and convulsions, and he was like, we've got to get to the bottom of this. This has been a long journey. And they are thousands upon thousands upon thousands of us. And our Louisiana Department of Health, our prior Louisiana Department of Health, they failed me. There is articles out there about me that was stemmed from their response, because when my videos went viral, they started reaching out to the Louisiana Department of Health. And their response was, we have no record. So then all of these articles started coming in that I was a fake. Forbes magazine has written articles about me. Rolling Stones has written articles about me. Yahoo has written articles about me. And I even have my own article in WebMD. My own article calling me a fake, and I'm basically, it's all in my head. Well, I have provided you guys with my medical records that shows you it is not in my head. And I guarantee you I have thousands and thousands and thousands of more of us that will provide you medical records showing that it is not in our head and we need some help. And I am coming to you, my people of Louisiana. We have a lot of us residents here. We need help. I didn't mean to make all of this about this vaccine, but you guys need to know I was not given informed consent. I did not know that this was still under emergency use authorization. I did not know anything about Veris. All of these doctors, I highlighted every one of them that dictated I had a reaction to the COVID vaccine. Not one of them reported my reactions. Not one of them got up, called the CDC, the FDA, Pfizer, or anybody and said, look, I've got this young lady in my room and she needs help. What can we do? None of them. And you know why? Because of that letter that was sent out saying misinformation.
The doctors could not speak about it. If they did, they would be terminated, or they would have repercussions, or they would have had to go before a board. The ivermectin that you guys have been talking about today, ivermectin saved my life. In June, when I had lost, June of 21, I had lost the use of my legs for the third time, and I did not want to live anymore. I was done. I didn't want my children taking care of me. I didn't want my spouse to have to take care of me, and I was just done. And the American Frontline Doctors had reached out, and they had gave me some ivermectin, and they said, I don't know if this is going to work for you, but let's try it. And it worked. Within 10 days, I was out of that wheelchair, and I was walking again. And it worked. When Hurricane Ida came through, in 2021, August 29, 2021, I couldn't get my ivermectin anymore because on August 26, 2021, the CDC had said, we're going to quit prescribing ivermectin for COVID and COVID-related injuries. Well, my diagnosis was a COVID vaccine injury. So guess what? The one thing that kept me out of that wheelchair and the one thing that kept me walking, I couldn't get any more. My husband went to every pharmacy in the greater New Orleans area trying to fill my paper prescription, and no pharmacy would fill it. So this is what I have lived through. And what all of these doctors are up here telling you, it's true. Me and my friend Carolina, we've lived it. And there are many more of us. And we need help, guys. I don't know what we need to do, but we need help. I have been now diagnosed with stiff person syndrome, which is an automatic qualifying disability through the state of Louisiana. It is documented in my medical records, and my disability case went all the way to the federal court, and I was still denied. I've had no income since January of 2021. Thank goodness I have a husband, because a lot of my injured friends don't, and they've lost everything. We need help. I don't know what we need to do. I'm just telling you guys, and I am begging y'all, please help us. And I'm not going to take up any more of your time. Thank you.
Ms. DeSalle, thank you for your testimony. Just want to apologize.
Thank you.
This shouldn't happen. This should not happen. In a free world, in a free society, as the United States is supposed to be, this should never, ever happen.
No, it shouldn't.
On anyone's watch. So because you've been let down, for what it's worth, as a former military member, and we have a bunch of vets on this, in this committee. And we all took an oath to defend.
Thank you.
And I believe we all feel your pain. And we apologize.
Thank you.
I'm sure that we will continue to endeavor and continue to work to prevent this from happening again. I know I sound like a broken record, members, but we're getting later into the afternoon. We'll open up to some questioning. Representative Edmiston.